Thank you, John, and good evening, everyone, and welcome to our program. We're very excited to have you all here. And I need to say Happy Lymphedema Awareness Month, and that's the reason why we're hosting this event here tonight. Tomorrow is World Lymphedema Day, but March is Awareness Month for lymphedema, and the theme this year is Talk About Lymphedema. So we want you to go out of here tonight and we want you to talk to whoever you have contact with during the month of March and let them become aware of lymphedema and the impacts associated with it. So we're really delighted that you've come, and I was asked to talk about early detection and self-care or self-management. And as I'm sitting here, and I have to congratulate Jasmine because you were inspirational and really touched me hearing you, and I was probably the one that dobbed John into meeting you in the first place and bringing you here. But really, when we talk about lymphedema, you are probably all the experts here because many of you have seen therapists or seen health professionals, and many of you, I think, have been visiting a whole lot of different people at different times on your journey of lymphedema. So I'm no expert. I'm here to share my knowledge and experience, and hopefully later on when we have the question and answer, you'll be able to share maybe some solutions that have helped you as well. So we know lymphedema is a condition and it does impact people's lives. As John mentioned and from previously, it affects people physically in so many ways. Physically with symptoms of heaviness, aching, swelling. From a functional point of view, not being able to perhaps do everything that you want to be able to do. Psychologically, it's that hidden thing. You often want to hide the fact of having lymphedema, and sometimes you can't just hide it. And putting those compression stockings on shows other people that there's something wrong. And I've had women and men say to me that some days, depending how they're feeling and how other people react to them, when they notice their arm sleeve or a stocking on their leg, they might tell them that it's lymphedema and might go and educate them about lymphedema. And other times they just don't want to have that conversation and they don't want to let them know, and they might say it's a shark bite or I've been burnt or something. And I'm sure you've had that experience, whether you decide who you want to tell, who you want to let into this sort of private information. And then, as John's already alluded to, lymphedema affects people financially and economically, and we're very aware here about the impacts of living with lymphedema and the financial costs, and hopefully we can demystify some of those later on in the session. And again, you might have your own tips to help other people at getting better management in the community. So I'm talking about early detection and early warning signs of lymphedema and how to manage it. And I'm very aware that some of you may not be in the really early stages. So again, you might have tips to help us later on. But what we know is that with lymphedema, you don't wake up one morning and you have a full-blown arm or leg. Usually lymphedema and the onset is gradual. And sometimes the common symptoms are a heaviness or aching in the arm or leg before you see obvious swelling. So even if you potentially are at risk of lymphedema, then we want you to be aware of these early signs and symptoms. Sometimes it can be as simple as noticing rings or jewellery or shoes that are feeling tight, or you get indentations from socks in your legs when you're starting to get some swelling, or when you notice that the symptoms are more severe. And sometimes too you can get transient swelling. On the hot humid days in December, January, February, even here tonight I'm feeling a bit warm, you may notice changes in the fluid in your limb based on the weather. How many people notice that? Hot weather, lymphedema is usually worse. So I guess our real message and what we see from the literature in supporting lymphedema management is trying to get lymphedema early and try to manage it early is going to give you better control. And we've certainly done some research that we've been looking at the effectiveness of early management of the condition. When we talk about, well, what do you do for your lymphedema limb? There's lots of myths out there about lymphedema. And those of you who may have learnt about this or had this condition for a very long time, we're actually telling people very different things of what to do with their arm or leg now than what we were 20 years ago. And in fact, I'm actually telling people often the opposite thing than what I was telling them 20 years ago. And that's based on research. There's been a lot of evidence that's been published in the last 20 years. And I think for those of you who may have secondary lymphedema after cancer treatment, 20 years ago we were just concerned about curing the cancer. And often people would tell me that they were told, just put up with the heavy, aching, swollen arm or leg because we've cured you from your cancer, and you should be happy that we've cured you from your cancer. And those doctors, they are happy and that's their focus, but they don't understand that men and women are living with the side effects of the cancer treatment for a very long period of time. And that's where, I guess, our program and our passion for looking after people with this condition comes from. So the most evidence-based information that we want to educate people about now is trying to use your limb, your arm or your leg, whatever part of your body that's affected, we want you to use it normally. So in the past we said, you know, protect yourself, don't use it, just sit and don't do activity or exercise. That's out the window. We want you to move. And why do we want you to move? Is because the muscles help to pump the lymphatic fluid. And you're going to hear that throughout the program tonight. Hero will be talking about the lymphatic vessels and how we see them under the camera. And Andrea is going to be talking about exercise. We might even get you doing some exercise later to help move your lymphatic system. Because even just sitting here for an hour, your lymphatic system is going to go to sleep. And we want to move it. We don't want those limbs to feel fuller and bigger by the end of this session. Something that Jasmine said was really interesting. She said, become in tune and aware of your own body signs and symptoms. And I think that's really important. I think for those living with a lymphedema condition or even a lipedema condition, you need to listen to your body. And sometimes we try to be super people, super women, super men, thinking, don't worry about the lymphedema, I can do this. But often we crash because our limb explodes if we overdo things. So we're not saying you can't do a normal activity, but sometimes you have to pace yourself. So you might get up and think, I'm going to paint this room in the morning and I want to get it done today. How many of us think like that? We've just got to get this activity done. We've got to mow the lawn or whatever it is. But if we do it all at once, our lymphedema limb really blows up, or we get heavy aching feelings, or we get episodes of cellulitis. Can anyone relate to that sort of thing? A few nods. So what the message is, we don't want you to not do those activities, but we want you to pace yourself, upgrade your activities so that you might have a bit of a rest in between completing the activity. And when you look back in 3 months' time, are you going to say to people, it took me 6 weekends to paint this room? Or are you going to say, I painted this room and doesn't it look great? So that's the mentality we need to start thinking. We need to look after ourselves, we need to look after our body and pace ourselves. Slow and steady wins the race. Don't try to be the hare that wins the race and then crashes. The tortoise approach is the way we want to move forward. Okay. Maintaining a healthy weight is really important in helping to manage and reduce lymphedema incidence. Now that's really hard though when you've got a big limb and it's difficult to exercise or do a lot of activity. So we're not saying go on a crash diet, no way at all. But what we want you to think about is pacing yourself and trying to do some level of activity or exercise over time. At the same time, we want you to look after your skin to try to reduce the risk of getting cellulitis or an infection in your limb. So sometimes people are told, put moisturising cream on your arm or your leg, but you don't understand the reason why. So the reason is that we're trying to look after your lymphatic system here. That your lymphatic system's major role in the body is to fight infection. So if you've got a compromised lymphatic system because you've had lymph nodes removed or radiotherapy treatment or just primary lymphedema and you've been born with it, then we need to look after the lymphatic system. So I suggest to my patients, put the moisturising cream, and it doesn't matter what brand or what cream you use, put it next to your toothbrush, and when you go to brush your teeth of a night time, you put your moisturising cream on. And when you put your cream on, don't sort of rub it up and down in any old direction. We want to put the cream on in an upward direction of your arm or leg or the body part that's affected, so it's trying to encourage the lymph fluid to move up and out of the limb and try to get it through the main trunk system. So moisturising, the reason is to try to reduce infection. We've talked and going to talk more with Andrea about exercise. Now, some of you people here may think gym exercise is the best thing in the world and get to the gym every single morning. How many of you do that? A few. Good. I'm not one of those. How many people like walking around the streets and enjoying the neighbourhood and seeing what's around? Fantastic. Good. How many of you like exercise in a pool aqua aerobics or walking in water, fantastic. So even in this group of 100 people, different people like different exercise. So as lymphedema therapists, we're not going to prescribe you must do this certain activity or exercise to look after your lymphedema. But what we want you to do is choose an exercise that you like doing, knowing that it's going to help pump the lymphatic vessels, and that's going to be better for your limb and for yourself. And then we've got there about compression garments, and we're going to talk about compression garments and how we access garments, but it's something that you really probably need to have a discussion with your lymphedema therapist to really talk about what are your needs and how you're going to manage living with lymphedema and using compression therapy. So when we talk about assessments for lymphedema, many of you have probably had a whole variety of assessments. And can I say the biggest thing that everybody has and can help to monitor their own lymphedema is using your thumb. And I'd say nearly 100% of us all have a thumb that we can use. And what we use the thumb for is the pitting test. So you get your thumb and you put pressure into your forearm or into your thigh or your calf, wherever your lymphedema swelling is, and you hold it there for 60 seconds, or you get your partner or someone to do that. And when you hold it for 60 seconds and take it out, see if there's an indentation, like a pitting, like a pillow that you've laid in, and then you get up and you get the indentation. And what the pitting test shows, if you've got fluid in your limb, okay? And if you've got fluid in your limb, that means you need some more conservative therapy. So some more massage or some compression therapy to help move that lymph fluid. Other things we use are the good old tape measure. And I often say that it's a badge of honour to be a lymphedema therapist if you've got a tape measure in your handbag. And recently I removed 5 tape measures from my handbag, so I'm a true blue lymphedema therapist. But you never know when you need a tape measure. You're going shopping and you need to measure something, I've always got the tape measure there. So that's something we always use, and probably all of you who have been seen by a lymphedema therapist have had measurements done with the tape measure. But we know that the tape measure isn't always the most reliable method of measuring, because it depends how firm, how much tension you pull on the tape measure will determine whether we're getting an accurate measure. Now these things down the bottom, again, some of you may have experienced if you've come to any of our clinics. This is called a pyrometer, and this is like a glorified tape measure. And these are more imaging techniques that we may use with you, depending if we have an understanding of your particular problem. And we use the MRI for those people who may be considering liposuction surgery, so we can look at the amount of fluid and fat tissue in the limb. Okay? These two up the top, I don't know if anyone's seen this one before. If you come to our clinic, you probably have. This is called bioimpedance spectroscopy, or you may have known it as getting an LDEX reading. And this is the technique that we've probably been using in Australia for the last 10 years or so. And it measures what we call extracellular fluid, which is the first part that we see change in developing lymphedema. And then we monitor lymphedema using this tool that we can see how fluid changes over time. The one next to it, I don't know if anyone's seen this, or you may have even participated in some research with us, is the next generation model of this one with the person lying. So this is called a SOZO device, and it helps in measuring lymphedema. So when we look at lymphedema, in the past we knew there were 3 stages of lymphedema. So we used to say stage 1 is mild, stage 2 is moderate, and stage 3 is severe. And you can probably think about your own lymphedema and where you fit along the stage system. And for many, many years, that's all we knew about the stages of lymphedema. Until now, we have what's called stage 0, which is the newer stage of lymphedema. And it's often where we put a lot of effort in these days to try to pick up early stages or early changes in lymphatic fluid in the arm or leg. So it's often referred to as subclinical, and if we were to use the tape measure, we usually can't see a difference in the tape measure because the change is so small in the limb. Okay? So it's not visible to the naked eye. And for those people who may have developed lymphedema a long time after possibly having lymph nodes removed, you may have been in this stage 0 for a period of time until the system goes out of balance, and then you start seeing obvious swelling. So how many of you have had an LDEX reading done to measure your lymphedema? Okay, how many haven't? Okay, so majority have. So this is technology that now is well known in Australia. It's actually Australian technology. And there has been a recent change to how we use the bioimpedance spectroscopy measure. So you may be aware that you were given a reading, a number of where the fluid was in your limb, your arm or your leg. And it was, if it was in the normal range, it would be somewhere between -10 and +10. That's where we consider the normal range for not having lymphedema. Where, you know, if we weren't at risk of lymphedema and we did this test, you would probably be in here. Now, in the past, we used to say if there was a change of 10 points from your baseline reading, then that would be a diagnosis of lymphedema or subclinical lymphedema. How many people have heard about a 10-point change? A few people? Good. You're all very well educated. Now what we know from recent literature is that we're actually looking at a change of 6.5 points from baseline rather than 10 points to detect very early changes. And I know this might not make a lot of sense for some of you who have very well-established lymphedema, but I guess if you're aware of what's the latest evidence and the latest information, I'm sure at some point in the future you may meet other people who have recently gone through a cancer diagnosis or had lymph nodes removed, that it's really useful that they be monitored for lymphedema so that we can detect it early and hopefully treat it early. And I guess this little graph just shows a woman's story when she's been followed up for breast cancer treatment, and how over time you can see that the readings were increasing, and this is actually showing that she started developing lymphedema. And the key message here, if I just put these three things up, out of 10.6, this is when the LDEX reading went above the normal range, what we knew was the 10. Then at 11.6, the woman identified that she had symptoms of lymphedema. And at 13, the tape measure showed that she had clinical lymphedema. And this change between here and here was actually 8 months. And in this article that was published in 2001, so a long time ago, it actually showed that between 6 and 10 months was this time difference of how we see lymphedema progress. And so the key message is we want to pick it up early so we have less invasive treatment and less invasive therapy. We know that this woman had surgery and her pre-surgery reading was -4. So I'm going to see who's awake here on this Monday evening. When do you think we should be now intervening? If we've said we need a 6.5 change from baseline, when do you think this person should have gone and seen a lymphedema therapist?
About 6.5.
Oh, you are awake. Exactly. At this point here is where we're seeing this 6.5 difference. And look how earlier it is than when she was actually getting treatment. And that's the key message of what we try to promote, is early detection and early management to try to reduce the need for intensive treatment. So that's one take-home message for those of you who have had regular LDEX readings. The other thing is, just wanted to highlight the new SOZO device that we're using for monitoring fluid. For those of you who may not have had LDEX before, it may be because you have lymphedema in both your arms or both your legs, because the previous device only monitored lymphedema in one arm or one leg. But this new device, great photo there, I must say, has capability for measuring both limbs. So if someone has lymphedema in both arms or both legs, we can now measure it using the LDEX technology. And the other exciting thing, and John was telling me before he's excited by this as a cancer specialist, that it can measure body composition or tissue analysis. And what this will do is link to what Andrea is going to talk about later with exercise. That sometimes when people go through cancer treatment, they can actually gain or lose weight while they're going through intensive chemotherapy and radiotherapy treatment. But sometimes what we now know is that putting on or losing weight actually is changing what's happening at a cell level and at a tissue level in the body. So sometimes people actually put on more fat and lose muscle mass. And we know that our body needs to be healthy by a good body composition of good fat, good muscle and good fluid in our body. And so this technology is now going to lead us into being able to look after and hopefully personalise or guide our education in exercise. And then this is my toolbox, and I often talk to my patients about a toolbox of strategies to help manage lymphedema. Because as a lymphedema therapist, I think I would get bored if I was talking the same message to every single person every single day. But my life is not at all like that, because the way a lymphedema therapist should be managing lymphedema is working with you as an individual, looking at what are the most important things that are concerning you in relation to your lymphedema, and thinking about your lifestyle. So we have simple things like exercise. We need to look at the whole person and your mindset. How are you coping psychologically living with this condition? Because I've had many people come in to me and say, there's no way am I wearing one of those compression stockings. And I know that if I prescribe them a compression stocking, they probably keep it in the drawer for 12 months and it wouldn't do any good for their arm or leg. So we need to work with you. And all of these different strategies, your therapist will be able to help you in guiding how to best manage your limb, but you need to be involved in that. So John's telling me to hurry up, so I will do that. As Jasmine said, and Jasmine looks amazing wearing her outfit today, so we can see her legs. I'm sure that's why you chose the outfit. But this was one of our other ladies who was 45 and came to our program from Queensland. She had a difference of 12.5 litres extra in her leg compared to the other leg. And she was carrying around that for several years after gynecological cancer. In fact, she couldn't even climb the 8 steps out front of our clinic building when she came first to see us. She underwent liposuction surgery, and 3 months after her liposuction surgery, she was able to climb to the top of the Sydney Harbour Bridge. And she stood up there and she said a message that was videoed to thank the team here at Macquarie for what she was able to do. And that's her there 12 months after her liposuction. She tells us she bought skinny jeans, which she'd never bought before, and was able to, again, like Jasmine, wear normal clothes. And that's her then, just in December. There's 954 millilitres difference in her legs now. You can't even tell. Remember, it was 12.5 litres difference before her surgical procedure. And I will say that surgery is not for everyone, and some of you are probably thinking, well, I don't want to do surgery. We're not advocating that. It's only for carefully selected people who are interested in going through liposuction surgery. So just in summary, I guess, when we talk about early intervention and self-management, your management needs to be tailored according to you and your lifestyle and your risk of lymphedema and how this is impacting your life. We need to monitor ongoingly because things change over time. We also recommend that you're involved in a multidisciplinary team approach, and you need to be feeling confident with the therapist or the practitioner that you're working with to help you in managing your condition. It's really important that you have individualised goals that are just for you. It's not my goals because you're the one living with this condition. And treatment may change over time as your needs and your lifestyle changes over time. I'm sure Jasmine's needs are very different now as 25 compared to 14 when you first sort of had this. Self-management is important. You need to work with the team, you need to take the tortoise approach and really empowering you to keep in control of your condition. And surround yourself by people who understand the condition and who want to help you. My last slide is just, some of you may have already seen this flyer, and I think it's in your handout as well. We are currently doing a study that we're looking for volunteers, and we would love any of you and hopefully all of you to participate. I've got two colleagues down the back, Emma and Alice. Where are you? There they go, stand up girls. Emma and Alice are working with me, and we would love you to volunteer to participate in this study. It means coming to Macquarie University for 1 hour. We'd even encourage you to bring a partner or a relative or a friend, because we're looking for healthy people who don't have lymphedema, and we're also looking for people who are living with lymphedema, both arm and leg, to participate in this study. So if you're interested, in the little break later, you might speak to Alice or Emma, or you can email me and we can put you in touch. So thank you for your attention, and I would now like to invite Professor Hiroswamy to join us.